Well, here we are on Love Bytes with Andrea Warshaw-Wernick. Okay, Andrea, I'm a gynecologist. About 12 years ago, they had this major study that was misrepresented to the United States and women all around the world that suddenly using hormones, peri and postmenopausally, were bad for you. And what we got from that misrepresentation right now is an epidemic of vaginal dryness. Vaginal dryness, the pain that goes along with vaginal dryness. We also have all sorts of concerns about my sex drive isn't what it used to be. And often in the office, women will come in and say, you got to give me that testosterone to increase my sex drive, when in fact, the problem is it hurts when they have sex. And who the hell wants to have sex if it hurts?
If it hurts, I'll tell you, I totally understand.
So, fab at any age, what do we do about this? Where do we go with this? How do you fix it?
I know how to fix it.
Good.
Being a lady in that arena of vaginal atrophy, it is necessary for a lady not to have that pain when they do have sex.
Oh, that's for sure.
Is to use some sort of estrogen, well, I think an estrogen cream, an estrogen patch, or even that new estrogen, what do they call the inserts?
The ring.
The estrogen ring is unbelievable. And once that ring is inserted, within 3 weeks, you don't feel pain anymore. You're back to when you were a girl.
I love it. I only wish that it was definitely true that within a couple of weeks. Sometimes it takes a little longer, but certainly getting estrogen there is important. Now, another thing we know is that blood flowing to the vagina, and I don't mean blood coming out of it, but blood flowing to it keeps the tissue healthy. When a woman gets aroused, the brain sends the blood flow to the vagina.
Right.
So this is where, and we were talking about it before, use it or lose it is important. Right. There's treating to make the pain go away, but there's also trying to prevent the pain from happening, trying to prevent the disorder, the problem, the dryness, the atrophy from happening. And one of the ways to do that is having sex. Because when you have sex or you think about sex or you're reading about sex, the brain is sending blood flow to the genitalia, and that keeps the tissue healthy. So putting something in, getting that blood flowing to the tissues is important even for prevention. Now, she doesn't happen to have a partner. What is she going to do to maintain? What's the maintenance for her?
Maintenance, ladies. Maintenance to get blood flowing to the vagina is usually with sex toys. I know that is like an evil word, we were brought up that way, but it's acceptable, ladies. You really have to have something. If you don't have a guy in your life or a companion, buy some toys. It's okay. Otherwise, you're going to have that vaginal atrophy. You're going to have that pain, and you're not going to have any more fun. So it's such an easy concept. Just learn your own body. You are alone, and if you're not alone forever, at least you have your toys to keep you company.
You know, it's a very good point, too. What do the sex toys actually do? Well, getting back to blood flow, if you're utilizing the sex toy, you're becoming aroused. That enhances that vaginal blood flow. Right. So that's number one. Right. Number two, with use it or lose it, is that the opening of the vagina itself as a tube narrows when you don't use it. So when we talk about stimulating the blood flow with something like a vibrator, we're also talking generally, and you correct me if I'm wrong here, putting something in the vagina, so we're talking more there about something like a dildo.
Right.
And it doesn't have to be a $300 dildo, it could be a clean cucumber or a candle, you know.
Right.
Exactly. So expand on that.
Well, there are so many different kind of toys on the market. I actually have a site filled with toys. But
what's the name of that site?
It's Fab at Any Age, and it's in my store on my site. Okay. And we sell dildos, and we sell the basic sex toy, where it's not just the dildo. It's a combination of toys which you can use, where it will please almost anybody.
So basically, what we're pointing out here is it's not necessarily masturbation for the sake of having a sexual experience, or feeling that, gee, you know, maybe this is something my culture said I shouldn't do. We're talking about medical, physiological necessity with respect to preventing this vaginal dryness problem, especially if it's a woman who can't use estrogen, who can't or doesn't want to use any kind of hormones. Keeping that blood flowing is really vital to the concept of use it or lose it. And so we're giving you an excuse to go to the site, to go to get sex toys. Do it responsibly, take a look at it, see what the benefit can be. But let's take it one step further. Can sex toys harm?
You know, anything in abundance can harm. I mean, obviously. I mean, I'm not going to be using sex toys every hour of the day. But it can't really harm you. It can only help you, especially if you are dry and especially if you really don't want to use the estrogen. You really have to keep that area moist, and the only way it's going to happen is by constantly, or let's say every other day, using your sex toy and making your body stay young, making your vagina respond to what it needs. Otherwise, you're just going to be a dried up prune. And if you ever do meet that man or that lover, it's going to be really difficult to have sex. It hurts.
You know, in our movie Hot Flash Havoc, which you can get at hotflashhavoc.com or .net. Cheryl Kingsburg, who is a sexual medicine expert in Cleveland, said, you know, think of the difference between a big, healthy grape and then a real shriveled up raisin. And she really did that very well. I can't say that as a male, but certainly a sex therapist, sexologist like Cheryl can do that. And it's like anything else, and this is really important, everything in moderation. What I was talking about and teasing into about what's the downside of this is that I see responses from some women who come into my office who have used a vibrator on a regular basis, and now they're telling me, I just can't get off with my partner. There's not enough stimulation there because that vibration, the intensity and the frequency of the vibration has retrained them to expect that.
Well, it's unfortunate that there is nothing like a machine. However, it's not the worst thing on the planet, okay? So when you're with your partner and you have your vibrator, so you use your vibrator. I mean, seriously, I mean, there are worse things in life.
True, but there are some guys who look at that and go, what's the matter? I'm not good enough?
I know.
I got to hold this machine? Now, us enlightened males, we can deal with that. There's no problem with that. Hey, if this can be more pleasurable for you, let me help you with that. That's great. Let me be part of it.